Hey everyone, it's Zach with Palantir Research. Palantir is scalable and versatile and a true product that you really want to use to try to take over healthcare from all angles. Working in healthcare myself on the analytics end, I've seen firsthand how it is ripe for disruption. And we already know about the big major players like HCA Healthcare, Cleveland Clinic, and Cardinal Health to name a few. And those are for nationwide customers that have huge impacts, of course, on healthcare overall in the United States. But as I was scrolling through Palantir's Foundry for Builders, there were 18 featured on the program's page, and a large percentage, about a third of them, which is 6 out of the 18 featured, are healthcare related. So it made me curious on the type of companies that these small Foundry for Builders partners are, and where Palantir is trying to approach healthcare. And as a pleasant surprise, actually, the variety of angles the partners of Palantir are going after in healthcare, from biotech, drug discovery, diet, mental health, to just the data, to Medicare planning, to the whole rural market, shows a lot of diversity that they're trying to break into here. Now, for those who don't know the Foundry for Builders program, basically it's a way for Palantir to start getting into smaller startups and companies and partnering with them by having them use Foundry with the expectation that if they are going to be successful and scale over time, they've already built it from the ground up with their whole operation on top of Palantir Foundry, and should also showcase the value of doing so for others in that industry. And then in turn for Palantir, it also continues to build on the use cases they can spread throughout the industry and give real examples that they can show to future clients in a related field what Palantir has done to create value much faster since it's been done before. So it remains to be seen though if the whole program will be successful, but let's go into these healthcare partners here since I found them fascinating. I'll go into each of them briefly, but there are 6 companies which are healthcare related. We've got Headway, Altos Labs, Hopscotch Health, Amiria Health, Chapter, and Foodsmart. So first, Headway. They're really trying to help meet the demand of mental health in the United States, where a lot of these therapists do not accept insurance. According to them, it's about 70% because of the administrative burden. Now, from my own experience auditing claims, mental health is always tricky because it relies heavily on documentation, because it's not a physical surgery or diagnosis that can be backed up easily by an x-ray or symptom, but rather mental health, you have to go through the sense of steps of truly diagnosing a patient with that documentation, of course, along the way with the different sessions. Plus, it is sad to say, but an area of healthcare like this is ripe for fraud, waste, and abuse, since it is more reliant on these qualitative measures sometimes. Now, their approach is creating a network like any other insurer who wants to build a network of providers because they can guarantee them some level of payment. But of course, for therapists specifically. And being in the middle, they want to help connect these patients to ensure they can get the care they're needed without worrying about paying there, since they know that insurance will be able to take it. So it'll be interesting to see if they actually succeed here, especially because the social stigma has really been removed or at least reduced in recent years around mental health and getting help. Second is Altos Lab, who is trying to do research on cell restoration and cell rejuvenation in order to address diseases, industry, and disabilities. This is more of a biotech play, of course, but essentially Palantir looks to be playing a role in bringing together tons of data from academia and industry together to ensure that most data is available for specific kinds of research happening. And we know in this life sciences space, there's a ton of data points needed to show how different trials and output are reacting different ways to certain stimuli or chemicals, and if being on top of Foundry may even project out before even experiments are done physically on the likeliness of certain outcomes. So it's always great to see them in this space here, and they can really truly discover something big. Now, third is Hopscotch Health, and they are trying to address a big pain point in the U.S. healthcare system. They want to transform how rural America addresses healthcare. It's well known that rural America has issues with healthcare access, education, and just plain staffing to have those needs met. If simply looking for travel nurse positions, you'll find something very quickly and highly paid in these kind of communities, but they are highly undesirable and people don't take them because of where they are in a rural community or just a small hospital. Now, Hopscotch Health is trying to address these issues with the primary care access. So in turn, it means putting as much preventative measures in a place to help mitigate as much possible cases where diseases have become much more difficult to manage. And of course, they need to go to a more advanced facility. So rural health is still a big issue here, and I'm hoping they can succeed as well. Now, fourth is Amiria Health that is using data collection to try to develop new treatment and therapies, essentially since they're trying to be a data play in healthcare that can provide data insights on drug development. This is a competitive space here, and I can see them trying to use Palantir with the vast amounts of data to find patterns and insights much quicker than others. So maybe it can be the difference here. But it remains to be seen if this is really something that can be easily taken over. Now, fifth is Chapter. and they're trying to make that transition to Medicare much easier. For those outside of the US, Medicare is basically our government insurance for older folks that have retired. My parents are approaching this stage of life as well, and definitely is a big life decision on how you understand Medicare working as well as the financial impact. And that's going to have a huge impact on anyone, of course, on their retirement planning, but it can be a huge thing when you're making health decisions as well, with many different health outcome scenarios that can play out. They're trying to help make this process easier, and we know the elderly population is vulnerable, especially if they are reaching this point with many health issues already. And then lastly is Foodsmart, which I found fascinating as a way to tackle healthcare through nutrition and dieting. They are aiming to simplify how patients can eat in accordance to their condition. And honestly, for me personally, we know diet is a major component that can lead to the prevention of comorbid diseases like diabetes and heart issues, which are the major ones. And they've got plans centered around these kind of patients to hopefully simplify this process with the right kind of healthcare professionals. And we all know a lot of this does stem from weight as well, so I did see they had a plan around weight management, so it's nice to see this. So as you can see from these 6 examples, Palantir is working in healthcare not from the typical hospital or medical supply side that we've already seen with the major partners and the major problems they're trying to tackle in the United States. And of course, they're trying to increase efficiency and quality around that. But for these smaller players, they are addressing the health and business aspects that are adjacent to these kind of large providers, like prevention of diseases, drug discovery, or just the mere data and analytics for drug trafficking or tackling access in rural communities. The bright point to take away is that Palantir Foundry is the same product here. It's being supplied and applied in many different ways, even within the same industry. And these are for smaller players trying to scale up with the huge opportunity in healthcare in the United States. Now, if you expand that to the other industries, now think of those different niches as well within there. The opportunities seem endless. But what are your thoughts though on these companies and the overall Foundry for Builders program? Let me know below, and thank you all for watching and my channel members, and see you in the next video. Alright, now that they're all gone, thanks for making it to the end of the video. This is for the OGs and super supporters that want to show additional support to the channel by becoming a channel member and getting a ranked badge right beside your name showing how long you've supported the Palantir research community. I know it's really new here, but just click join or following the link in the pinned comment below. But on top of that, you do get access to member-only community posts that give you sneak peeks into my next video with more personal thoughts as well and priority responses, since I'll be able to track these much more easily. Now, you can literally influence the next video by giving your points and questions you want covered here, since I'm going to give it before I actually make the video. But I do work fast, so I just want to warn you there. But now the spiel's over, and thank you all for the support. Now I'll really see you in the next video.